I'm Dr. Medha Prabhudesai. I'm going to talk about congenital glaucoma. Congenital glaucoma is, if remains undiagnosed and untreated, is a devastating condition. It is a disease of the newborn. So patient as a newborn is not aware of what symptoms he has. So the parents should be very aware that what is going on with the patient's eye. There can be photophobia, there can be nystagmus, and there can be watering. Apart from this, the cornea might get enlarged and the cornea might develop haziness or white cornea. So these are the symptoms in the newborn child where the patient might have congenital glaucoma. So if these symptoms are there, the parents or the attending doctor should refer this child to a glaucoma specialist who is specialized in diagnosing and treating congenital glaucoma. So the diagnosis consists of patient's examination under sedation, where we give a short general anesthesia to see the intraocular pressure of the patient, to see how much is the cornea enlarged, see the axial length, and if possible, note the optic nerve. Once this is done, the only option to treat this is surgical. We can control the pressure by medications or some mild tablets, but this is going to be a lifelong medication, so it's better that we treat these patients with surgical options. There are 2-3 surgical options available where we can correct whatever is wrong with the drainage channels of the eye, and after this the eye is patched, and we need to observe these patients on periodic basis to see that surgery what we have done is controlling the pressure or not. So after surgery also, we cannot tell the patient to go away. We have to see this patient on periodic basis, at least initially once in 2 weeks, then later on once in 2 months, and then later on we can decrease the frequency. If we feel that the pressure is still not controlled and the disease is progressing, the patient may need further additional surgeries. Again, the patient cannot do routine tests which we are doing for glaucoma. So we need to take this patient in the OT, and under sedation only we can check the various parameters like pressure, corneal diameter, axial length. If the patient has any refractive error for that, sometimes the patient can develop lens opacities which are cataracts, and the refractive power and optic nerve head photographs also we can take. So depending on this, we can advise the patient whether when to come again, what drops to use, and how to follow up this patient. Once the patient reaches a certain age, certain tests like perimetry and OCT can be done. The most important thing is that the patients which are undiagnosed can go blind, and with the surgical help, which is a modern technology, we can correct this abnormality and the patient can live a totally normal life. So it is parents' responsibility to look for their patients, especially if the marriage is consanguineous, or if you feel that anyone in the family has congenital glaucoma like his brother or sister. This should be done as earliest as possible. Thank you.